Director Wray, as you mentioned earlier, the FBI has concluded with moderate confidence that the virus leaked from the lab in Wuhan. The intriguing thing is that if I were to say that, as I did, and others said this for over a year and a half, Facebook actually suppressed that knowledge, suppressed its spread, and its ability to be transferred from their users. Whether or not they did that at the behest of the FBI or the DHS is eventually going to come out in the court case, but it is a big deal. I've met with the FBI, and one of the things I'm interested in is trying to get people on both sides of the aisle to be interested in the possibility that what happened in Wuhan could happen in the United States. It could happen in 20 different labs around the world. It could happen with nefarious actors. It's something we should be concerned with, the idea of making and creating viruses that are more dangerous than occur in nature. One thing that would help us would be to reveal more to us of your conclusions. So, for example, for the longest time, I'm pretty sure it was classified that you had even concluded that. I think your public statements were the first time we ever were heard publicly that the FBI had actually made a conclusion. So even the conclusion was secret for a long time. Now, you had to have an analysis. You must have a paper sort of description of your thought process. We passed unanimously legislation to declassify all this stuff. Most of the stuff doesn't need to be classified. A lot of those conclusions are just basically, we've had them out in the public, and we've been discussing this. But it would help the debate and maybe help us prevent something like this from happening again if you'd release your report. Are you going to declassify and release your report that allows you to conclude with moderate confidence that the virus came from the lab?
Well, I know my staff has been engaged with you directly on this, including the head of our WMD directorate, and I expect that to continue. I know you've asked for a number of documents that I believe we're getting ready to provide to you potentially as early as this week. As to what can be shared publicly as opposed to shared with you in your oversight capacity, that gets a little more complicated because sometimes the information is interwoven with other agencies' information we don't entirely control.
We don't want to know who your sources are. We want to hear your conclusions. We want to have what your scientists have looked at. And one of the specific things we asked them, they said they would be forthcoming with, and the meeting seemed to include cooperation, but then they just go dark on us. So, for example, one of the most important information from my point of view that suggests this came from Wuhan is that in 2018, the lab in Wuhan, along with a scientist at University of North Carolina, along with Peter Daszak, applied for money from DARPA. They wanted to create a coronavirus that had a cleavage site in it that's more commonly found in human viruses. They were denied the money, but that led us to thinking, and a lot of people thinking, wow, they were already asking for money to create a virus that has the same structure as COVID had. There apparently are other grants, and I've been trying to get the grants from government for 3 years. The most secretive organization in our government with regard to COVID is HHS and NIH. We pay for all their grants. None of their stuff's classified. They won't give us the stuff. But I think in your review, my guess is your people knew where to look, and I asked them, are there other grants like the Diffuse grant from DARPA that was denied that you can point us to, 4 or 5 other grants, so either given to them in Wuhan, denied to them in Wuhan, maybe given to another country somewhere around the world, but worried us that, and were circumstantial evidence leading us to the conclusion. Those things should be easy. They're non-classified. We can't get them from the NIH. If you've seen them, we just want you to help us because it needs to be public because our concern is this could happen again. There are scientists, legitimate, pedigreed virologists at major universities who believe not only that this came from this lab, but the next one could kill 5 to 50%. What if they're aerosolizing Ebola virus or Marburg virus or Nipah virus? This is as dangerous as nuclear weapons, but we've had only one side sort of interested in this so far. But if more information were revealed, maybe we can get both sides of the aisle interested and eventually do something to try to prevent this from happening again. And so if you will help urge them to give us some of the information and really figure out how to declassify stuff. I know most of intelligence is classifying and keeping secrets, but there's important public policy decisions that come from making it public. And do it in a smart way where you don't reveal things that you don't want to reveal, but I'm guessing 99% of the report probably already includes no classified information.
Well, we look forward to working with you on this. I'm very proud of the work our folks did here. It was rigorous, it was thorough, and for an awful long time, we were the only agency all by our lonesome reaching that assessment. And we will look forward to working with you as best we can. I will say we continue to investigate, so there may be some issues that get wrapped up in that, but I know that our folks have found the engagement with your office to be productive, and we look forward to continuing that.
One really quick point, for those who doubt that this came from the lab, the FBI has concluded with moderate confidence. The Department of Energy, which has a lot of scientists, probably more scientists than any other part of our government, has concluded with low confidence. And the Lancet Commission and the minority report from this, Bob Cadillac's report from this committee, a number of groups that spent a long time have come to the conclusion, not for partisan reasons, because we worry that this is going to happen again or could happen again. So I think we should try to all work together to see what we can do to restrain and restrict this type of dangerous research.
Thank you.